As a psychiatrist and a researcher, what I'm looking at is really going behind the face. Having facial surgery, whether it's for trauma or for cancer, is an extremely stressful event. And the kind of research questions that we're asking, one of the main questions is, are all people going to experience psychological distress? Disorders like anxiety, depression, and a more severe sort of anxiety, which is post-traumatic stress disorder. Does psychological distress actually affect the prognosis and the treatment outcome following facial surgery? This is a group of 220 patients with trauma. You can see that over 20% are actually suffering from acute stress. And acute stress at these levels is highly predictive of post-traumatic stress disorder occurring several months later. We have about 30% who have depressive symptoms, and then a higher group that have anxiety symptoms. These are head and neck cancer patients, these are colorectal patients, these are patients with breast cancer. And it's about 20% of people with head and neck cancer who are experiencing depressive symptoms. It's not everybody, and people intuitively think that head and neck cancer, there's going to be more distress, but in fact that's not what we see in the clinics. Does psychological distress affect prognosis and treatment outcome for these patients? And I'm going to be talking not just about survival, but about the outcome of quality of life. These are patients coming in being diagnosed with cancer, and they have surgery very quickly afterwards. And what we asked people to do was complete validated questionnaires asking them about depression, anxiety, stress, their quality of life. We also asked them about past experiences of stress. And then we also took blood samples, and we were actually measuring biological markers. In this instance, we were measuring inflammatory markers. What caused them to have poorer quality of life was not the extent of the surgery, but whether they had depressive symptoms. Those people who had higher levels of inflammatory markers at diagnosis were much more likely to have poorer quality of life at 6 months. And we know that high levels of inflammation are associated with depression and with stress. Behind the person, we have the family. And we're also interested in looking at not just the effect on the family, but what effect the family has on the patient. This head and neck cancer patient saying, I think it's more stressful for my wife. I'm sure that she's devastated by his diagnosis. And this is the data from patients who are coming in. 16% of them have high levels of depression, 40% have high levels of anxiety. The blue ones are the patients, red ones are partners. But the partners have higher levels, much higher levels. What we're finding is that patients whose partners are distressed have poorer quality of life. We can make an intervention both to help partners and families, but ultimately to help our patients have a better outcome. Loneliness is a very powerful stressor. So people who are lonely are under a great deal of stress. And we know that stress is something that increases inflammation. And we know that's not good. The bottom line is that we want to improve treatment outcome. We want to be able to identify those people who are vulnerable to the effects of stress and who are likely to suffer poor quality of life. We can deliver different kinds of psychotherapies, cognitive behavioral therapies. That's together with exercise therapy for those who have fatigue, but we can introduce those at quite an early stage. We can provide support for the families. So I'm going to just say thank you to our patients because they came in at an incredibly stressful time of their life when they were diagnosed with cancer. And on day one, they were taking part in our studies and giving us those very important data samples so that we continue this work, hopefully, with NFORC.
This is absolutely brilliant, creating the world's first ever research centre dedicated to this most socially sensitive part of our body, which will collect major data and organise research to improve patient treatment worldwide. Well done, Saving Faces.